All right, so it is 11:27. Rebecca is back on, and we're going to take a roll call to make sure everyone else has made it back on.
Great, thank you. Sorry about that, everybody. I'm going to go ahead and take a roll call vote to make sure that all of the members are back. Dr. Thompson?
Present.
Thank you. Dr. D'Amico?
Present.
Great, thank you. Dr. Singleton?
Present.
Thank you. Dr. Quinn? Moderator, do you still see Dr. Quinn online with us?
I do. And as a reminder, Dr. Quinn, if you are utilizing your computer and telephone, you will have to unmute your computer to access the audio.
I will come back to Dr. Quinn. Dr. Davidson?
Present.
Great, thank you. Dr. Yoon?
Present.
Great, thank you. And Ms. Shirley Worrells?
Present.
Thank you so much. Dr. Quinn, are you back online with us?
This is the moderator. I do have the ability to manually unmute him if you would like me to do so.
Sure, that would be great. Thank you.
Dr. Quinn, you are currently unmuted. It does appear he has his audio connection available.
Okay, great. Thank you. And I did hear him a little bit, so I know he's there. Thank you very much. I appreciate that. Okay, we can go ahead and proceed.
Wonderful. So we're on to agenda item number 9, which is like an extensive one. It was about half the meeting material that we received. So Rebecca, do you want to update us on the MPLEX discussion regarding online testing? I know that the issue here is, of course, the ongoing COVID epidemic and trying to get people to a situation where they can do their licensing testing safely.
Great. Yes, absolutely. So agenda item number 9 is regarding the Naturopathic Physician's Licensing Examination. As we discussed during the December 1st meeting, the future of NPLEX and the online examination is something that NABNE is looking into. Today, I asked Tracy Montez to come and provide some information on the risks and challenges that are associated with online examinations. So Tracy, if you're with us, I'm going to go ahead and pass this over to you.
Good morning, Rebecca and committee members. Thank you for this opportunity to share with you information that our office is presenting at various board, bureau, and committee meetings with regard to online or remote proctored exams. I did provide a couple of memos to your committee members. So I'm just going to, summarize these memos and then open it up to any questions that you may have. The first memo was actually addressing the specifics of online remote proctoring. And as we can all imagine, the COVID pandemic has impacted our ability of our regulatory agencies to administer licensing exams in a timely manner. I'm happy to report that overall the department has not been impacted as significantly as other areas with regard to our workforce. Our vendor that administers computer-based testing exams for many of our programs only shut down for a very short period of time in March of 2020. They did reopen, as well as the other vendors that do computer-based testing, in April. And as of September, most of these vendors were back at full capacity administering examinations throughout the nation. And it's important for me to share that they did this under, and I should say continue to do so under CDC protocols for safe distancing with regard to the pandemic. But as we did see some impact across our programs, many boards, bureaus, and committees were approached about the option of online or remote proctoring for their examinations. And the department, after consulting with the Office of Professional Examination Services, which functions like an internal consulting firm within the department and adheres to national protocols, testing protocols, advised the boards, bureaus, and committees and the department as a whole that for high stakes testing, we do not recommend this option. And the reason is that there are still many, many unknowns with regard to security of both exam content and candidate privacy information. And while it seems like a very simple process to turn on your computer, log in, and take an exam, there are many, many variables that should be considered. And I listed those in the memo that was dated February 12th for you. And you can see again, it talks about the types of tests, the equipment needed, safety issues, security, legal issues. So there's just a variety of things or factors that should be considered when making this decision. Now I will share with you that the Court Reporters Board does do online proctored exams, and this is for our certified shorthand individuals, and it works quite well. It's a little different kind of exam. We do have some other organizations that are looking at possibly implementing this, but we do know that even our computer-based testing vendors are hesitant with regard to recommending this option for exams that have a very long length to them, 3-4 hours at a time, because we know candidates will get fatigued. And so if they were on site, they would be taking breaks. Well, how do you build in breaks when you're at home? Again, can candidates go back to material after taking a break? Can they only move forward? Also, again, going back to exam subversion concerns, we have had situations where we have heard of candidates who have taken notes and have gotten caught doing this. There have been some issues with the state bar exam, for example, that is doing this option. So for DCA exams, again, we are advising boards to really carefully consider this option and to potentially look at other exam administration options, such as computer-based testing, which I don't think your exams do at this time, and certainly that could be something to pursue. So at this point in time, I'm going to stop talking and see if you have any maybe initial questions about online or remote proctored exams. And then if you like, I can go into what's involved in developing a state licensing exam. Does that sound reasonable, Rebecca, or would you like me just to continue speaking?
Yeah, no, Tracy, that would be fine. It looks like we have a couple of questions on the side from Dr. Thompson and Dr. D'Amico. Dr. Thompson, do you want to go ahead and go first?
Yes, I just had two clarification questions. You said that the testing sites were temporarily closed but have been reopened. So right now, there is the ability of our licensees to do in-person exams. Is that correct?
I don't know about your particular exams. Rebecca would need to answer that question, but for the exams that utilize the department's master contract for computer-based testing, which I know your committee is not a part of, those exams continue to be administered.
Okay, so that's definitely something for us to figure out, because it seems like one of the large issues with in-person testing is how far away people are from each other. And so if it was computer-based testing where everyone's in their own little cubicle, that's a very different situation than being in a large room with a bunch of other people.
Correct. And that's why we're very pleased with our vendors, because they responded immediately to COVID, and we had reduced capacity initially. And then as we learned more about the virus, and there were opportunities to open up further, then they implemented the partitions, the mask wearing, various things like that, again, to protect the candidates coming in to take the exams.
My other question was about how we've been dealing with this for people with, disabilities who weren't able to go to these sites to begin with. So certainly we must have had candidates in all professions who needed to have some sort of alternative testing because of limitations.
Right. And again, with our boards and bureaus that use the master service contract, we did have only a handful of inquiries, and essentially they needed to make arrangements to come on site to take the exam, because due to the high stakes nature, the security issues, there are ways to accommodate candidates on site to give them, say, for example, their own testing room. And with the sites spread out throughout California and nationally, there's the opportunity to maybe do travel by car. But yes, we did have some questions about that, but in these situations, they were not offered an online option.
Thank you.
Dr. D'Amico, did you have a question for Tracy?
Yes, I have a question and a follow-up. Tracy, thank you for all the information, and I understand that you are addressing those programs who utilize the state's program to administer testing, but I'm not sure that the NPLEX actually does use that. And I'd like to just back up for a second and ask, are the individual states actually responsible for administering the NPLEX test currently?
Dr. D'Amico, no, they're not. So currently, NABNY is responsible for the administration of the NPLEX, and they work with different sites that they have contracted with in order to provide those test sites and have the proctors in place. I do know that, going back to Dr. Thompson's question about disability needs, that they do try to accommodate as much as possible. They have also allowed individuals to take another scheduled test. So they are accommodating in that matter, but it is an in-person test. And these states, all of the regulatory states in Northern America, including Canada and the United States, all use NPLEX. It has just been recently that Ontario has decided to use their own examination, which really was kind of a concern and a challenge now, because their exam does not represent and is not equivalent to the NPLEX. So we're now having issues with people coming from Ontario that want to come in that did not take the NPLEX, that only took the CONO test. They don't meet the qualifications and requirements to become licensed in the United States and other places in Canada. So there are some issues when you go and start making new tests, because not everybody's going to accept them. So that's kind of where we are right now.
Okay, so we have currently, with the exception of Ontario, a single test administered by a single organization that covers all naturopathic doctor qualifications in North America, Canada, and the United States. So this whole information from the state regarding online examinations is only if the people, the committee, and in California wanted to take over testing and qualifications of naturopathic doctors and then administer it through a computer-based test, which of course costs millions of dollars, which we don't have. So I kind of feel like it's great to know the landscape of what's available and what's possible. But I feel at this point that we could move on from this subject in whatever way is appropriate and say, okay, thank you. We know this is wonderful to know, and we know we have the option, but at this time we've got something that works quite well that doesn't cost us any money or effort.
Dr. D'Amico, thank you for that.
And this is straight.
Hold on one second. So just to be clear, the reason that we're having this discussion and that I brought Tracy today to present some of this information is because there have been some chatter, and NABNY is going to be going out to try to find out if any of the states would be accepting of online proctored exams. And the reason being is because if just one state regulatory entity says no, they cannot move forward with that because all of the states right now accept NABNY or the NPLEX. So that's kind of where we are. We're just trying to get some information from our state so that we can provide NABNY with would we be interested in going to an online exam, or absolutely not, we do not feel that this is appropriate at this time. So that's kind of what we're doing here today. Tracy is providing some information as to what would be available if we just said, look, we're not going to go with NPLEX anymore. We're going to do our own exam, which I really hope that that's not the case, because it would cost a lot of money for us to do.
Yeah, so I propose that we take a position that we're not interested at this time if the rest of the committee agrees.
Can I jump in real quick? This is Tracy, if I may.
Absolutely.
Can you
Tracy,
hear me?
Please do. Yes, we can.
Okay.
Thank you. Go ahead.
So, and I apologize because my internet connection was a little bumpy, so I didn't hear all of Rebecca's explanation. But yes, I do concur that you have an exam that is working wonderfully. We would
Is everyone else having difficulty hearing
jury
Tracy?
license because that
Yeah.
certainly substitute.
This is the moderator, Tracy. I apologize, but you did cut out during a large portion of your response. I would ask that you please restate
Okay.
your response for the panel.
Okay, I'll keep it short and sweet. Just flag me if I cut out again. So again, I encourage you to stay with your national exam. It's doing what it should be doing. It's too expensive for a state exam. I will say, though, that it certainly is a possibility to work with NABNY on doing a computing. We work with many programs. For example, the Board of Psychology, they use a national exam that's computer-based. Many of our boards have national exams that are computer-based. Part of the computer-based testing contract, it's a minimal cost that candidates typically absorb. So it's not expensive to do computer-based testing, and I would encourage NABNY to do that. We know that the USMLE is now going to computer-based. They're actually discontinuing their on-site clinical exam. So again, there are some things that we could potentially help your committee with to improve accessibility for candidates. But again, to restate, you do have a good exam. We encourage you to continue using that for transportability for your candidates. And thank you for the opportunity to be here today.
This is Dr. D'Amico. Tracy, did you just say that for part 2 of the medical exam, they're taking out the clinical portion, or they're doing it on computer?
Yes, it's my understanding that the part 2, they're going to be discontinuing.
Wow. That's where you actually get watched to see if you know how to do stuff correctly.
Yeah, they're really revising things in response to COVID and testing. Again, they're not reducing requirements. They're looking at alternative ways to test.
Gotcha.
But again, they're not, as far as I know, not looking at any remote or online at proctored at this time.
Well, I wanted to really thank you for helping us become aware of the landscape of this subject, because certainly, and for the opportunity to put this on the public record, because there will be questions as the years go on about this. And we can at least say that we looked into it thoroughly and, you know, what the issues were, and that we're, you know, open to it in the future. But right now, that's what we decided. So this is a really great thing to have done.
Yes, perfect. And again, it shows due diligence on the behalf of your committee. So anytime we can help you, we are available.
Great. Thank you, Tracy. We have another question from Dr. Yoon. Dr. Yoon, would you like to go ahead and ask your question?
Yeah, sure. Tracy, I just wanted to know a little bit more about whether or not there are any other examinations that are 3 days long. So I'm not quite sure if the USMLE is 1 or 2 days, but our NPLEX, from last I recall, was 3 days. Is that actually, I don't remember. It's been a long time.
That's still
You know,
correct, Dr. Yoon.
Mine was 4, because in a different states they have a jurisprudence exam and they have optional exams like for acupuncture, and those were put on the 4th day.
And I'm not familiar with all of the exams, but I would have to say that that's consistent. It's those primary physician exams, healing arts, that are multiple days. But most of our other programs that we work with, it's a 3 to 4 hour exam, but then they have licensed supervision, other kinds of programs that are part of the qualification process.
So the computer-based exams that have been switched over that are 3 or 4 days, they've just accommodated, the vendors have just accommodated for those long periods of time. Is that correct?
We don't right now have any of those exams in with our master contract. The only one that I'm aware of is like the physician, and then of course your committee exam. Our other psychologists, geologists, those exams are just like 3 to 4 hours, or they may have multiple tests, like for architects, where it's in pieces or sections.
Okay, perfect. Great. Thank you for that information.
Great. Thank you. Are there any other questions for Tracy while we have her here? Okay, it doesn't look like it. Tracy, I want to thank you so much for coming in and providing this information to the committee. I'm sure they appreciate the information and providing the options that we would have if we decided not to stick with NPLEX, but I am happy that I think I'm hearing that the committee at this time would like to stick with NPLEX and would like to stay in person at this time test. But I would like to take the information back to NABNY and let them know that they would be able to work with us and Tracy over at DCA if they wanted to look into going to a computer generated type of exam.
You're very welcome. Thank you for the opportunity, and happy again to be available at any time. Have a good rest of your day.
Thank you. You too, Tracy. So is that what I'm hearing from the committee? I just want to make sure that I'm getting everybody's response on this, and then we can take a motion to provide a recommendation to NABNY, if that would be okay.
I believe that Greta, quite a bit ago, did actually make a motion, and then we talked a bit more. So I think we only need a second on that.
Okay.
And I would second that.
Great. All right, so I am going to go ahead and do a roll call vote to provide NABNY with recommendation to oppose moving NPLEX to an online exam at this time, and we were keeping it in person, but that we would like to maybe have some conversations down the line in what we can do to move NPLEX to a online, with an online vendor. All right, Dr. Dara Thompson.
Aye.
Great, thank you. Dr. D'Amico.
Aye.
Thank you. Dr. Singleton.
Aye.
Thank you. Dr. Quinn.
Aye.
Thank you. Dr. Davidson.
Aye.
Great, thank you. Dr. Yoon.
Aye.
And Ms. Worrells.
Aye.
Great, thank you very much. We've got 7 ayes and the motion moves. Thank you so much.
Do we need to request public comment at this time?
Yes, that would be appropriate. Thank you.
This is the moderator, and at the direction of the committee, I have opened the Q&A panel. If you would like to make a public comment, please click on the comment button and type "I would like to make a public comment." I will now pause momentarily to allow individuals time to access this feature. We have received no requests for public comment. Would you like me to close this feature?
Yes, please.
Feature has been closed.
This is Dr. Thompson. At this time, I just want to check in with the committee members. We only have a few more agenda items. It is coming up near noon, so we could certainly move through these agenda items, and I think we will likely be able to adjourn by around 1 o'clock. Just want to make sure that's not going to be too much of a problem for people regarding lunch. Are there any issues with us moving forward to get through these last agenda items? I don't see anyone's hand raised, so we are going to move forward with agenda item 10, the executive officer update, which Rebecca will be giving as our executive officer.
Great, thank you, Dr. Thompson. So the first item under the executive report today will be the budget update, and here to provide that update on our behalf is Carl Bierman. He is our analyst, and I'm going to go ahead and turn the presentation over to Carl.
Good almost afternoon, everybody. It's a pleasure to be here today. I was asked to present an overview of the budget change proposal process, what we refer to as a BCP. However, before I go into the BCP process, I just wanted to give a very high-level overview of the annual budget process first, because they're parallel processes. And so it's important to understand how the BCP process fits into the regular budget process. So as you can see on the slide here, I'm going to start at the top left under annual budget process. And just to give you a little bit of a background, the typical budget cycle goes July 1st through June 30th every year. So we're all on the same page about that. So typically in August through December, we start budget building drills. And this includes all the adjustments that I discussed at the previous board meeting. Things like employee compensation increases, benefits, retirement, as well as any anticipated budget change proposals we'll put into the governor's budget each year, because we do an incremental budget process where we take last year's budget and then make adjustments to it. It's not a zero-based budget where we start from scratch every year. And then on January 10th, the governor's budget is released. So that happened, a little over a month ago. And this is all for the upcoming year. So the next budget cycle starting July 1, 2021. And then February through June, we go through the enactment of the budget. And this is essentially the internal controls that are put on a budget where subsequent bills get submitted through the legislature, so the Assembly and the Senate, and they go through, review, make any comments. The Legislative Analyst Office will also review and make any comments that they have as well. And then, assuming they both agree on everything, they'll sign it and it goes to the governor for signature. After that happens, it's what we call the Budget Act for the upcoming budget year. That happens on June 15th of every year. And that just means that it's been approved through all of the appropriate channels. And then starting July 1 is the implementation of the budget that we were working on in the prior year. So I know it can get kind of confusing because we're always working essentially 1 year ahead. So we're kind of working in the future. And so all these overlapping timelines can get confusing. So if you have any questions, let me know. So the way the budget change proposal process fits into all this is it fits somewhere in like when you have a final product in that August through December when we're developing the governor's budget. But the process starts long before that. So every year around April, the DCBA budget officer, which is currently Robert De Los Reyes, will send out a email that has all the instructions as well as examples, because Department of Finance changes the templates that you complete budget change proposals on. They'll send out a memo with instructions, writing style guidelines, etc., for what we call the concept paper process. And so once we get a concept in, we'll get that into the DCA budget office. We'll around the end of May. So you have a little bit of time to work on that, a couple of months. We'll work with the program on the budget change proposal before it's submitted. So we'll work internally on any recommendations that the DCA budget office may have, as well as the DCA executive office, before we submit to the control agencies. And so we'll work with you through all that. We look for proposals to be concise. Department of Finance reads hundreds of these every year, so any extra pages that we can cut, they greatly appreciate. So we try to keep them as short and to the point as possible because that is their preference. So after all this, we'll go through several rounds of edits and everything. The final BCPs are due to Department of Finance in September. It changes from year to year depending on when their budget letter is issued. That gives time frames. It's normally sometime in mid-September, but you can give or take a week, depending on the year. So then after that, October through December, finance reviews, they'll ask any clarifying questions that they may want, and we'll work collaboratively with you on those responses, and act kind of as a middleman between the committee and Department of Finance. So assuming Department of Finance approves everything, it will be submitted in the January 10th governor's budget, which is kind of that first arrow up top in the blue under the annual budget process. So all this stuff is happening kind of behind the scenes before it's released on January 10th. And then after that, February through May, we kind of get more in sync with the annual budget process here. They're submitted to the legislature as part of the enacted budget. And the legislature, along with the LAO, will have questions, and there will also be a hearing where you have to testify, and they may have questions for you in person there as well. And then, assuming that all that gets approved, it goes into the budget for the upcoming year. So currently, I know Rebecca has expressed interest in possibly submitting a enforcement budget change proposal this year. And so that's going to be upcoming. So that's something that we can work together on. As of fiscal month 6, which is the end of December, the committee is projected to revert a little over $50,000 due to some salary savings. And I believe Rebecca's plan is to use that for a limited term enforcement or temp help in enforcement until a BCP can be secured. So we'll start working on the BCP this year in April, but the actual proposal would not go through until July 1 of 2022. So it'd be for the 22-23 budget year. Any questions?
Great. Thank you so much, Carl. I appreciate you coming in and offering this information. Are there any questions for Carl before we allow him to get back to his day?
I just have a comment. I just want to say I really appreciate this schematic, just going step to step and really laying it out for us in this simple way.
You're very welcome. I understand that this is confusing. It confused me when I first came into the budget office too. So I get it. And as always, just let me know if you have any questions. You can flow them through Rebecca. We're in contact regularly. If you need assistance with anything, I'd be happy to help you out as much as I can.
Great. Thanks so much, Carl. I appreciate it.
You're welcome.
Okay. Can you go ahead and go to the next slide, please? Great. And you can go ahead and advance one more slide. Okay, so the committee, I'm going to start with the staffing and the office information. The committee was understaffed for an 8-month period while its sole analyst was out on an unplanned leave of absence. During this time period, all of the committee's workload was diverted to the executive officer. Everything was processed within normal timelines and there were no backlogs during staff absence. On 10/13/2020, staff returned and resumed duties on a half-time basis. The executive officer still covers any duties not currently performed by the analyst. However, due to a busy legislative and regulatory year and with the oversight review coming upon us, the executive officer position can no longer cover the workload of the enforcement unit. So at this time, I am looking to hire a part-time enforcement analyst. This may become a permanent full-time position in the future, depending on business needs, and that is what we were thinking about putting the BCP in that Carl had explained to you guys. At this time, staff remain working within a hybrid telework system without any issues. There has been some slight decrease in the licensing performance measures. While we always stayed within the 45-day processing times, usually under 35 days, it does appear that the processing times have risen to 52 days. This does go over our performance measures of 45 days. So I will continue to monitor this and find out what's causing the reduction in processing times. And I'll put policies in place to ensure that we get back to our normal processing times. While all state agencies are being asked to reduce expenditures, the hybrid telework option can assist with office space cost reductions in the future. In addition, we can do our part in reducing carbon footprints and allowing staff a better home work-life balance. However, business needs and consumer protections are mission critical to the committee. And if needed, staff may have to return to the office to bring those timelines back down under the performance measure standards. COVID-19, as everyone's aware, there have been several executive orders put into place that allows waivers of continuing education during the COVID period, state of emergency. And we also have a waiver that includes allowing the naturopathic doctor licensees to take online courses in lieu of in-person live courses. There is no expiration on that, and it will be in effect until the end of the state of emergency. At the first part of this year, the offices were closed to the public, but since have reopened. Additionally, sanitizing common areas, staff cubicles, high traffic areas are all being adhered to, along with social distancing, mask wearing, and using hand sanitizer when hand washing is not available. So we are definitely doing everything we need to make sure that all of the staff remains safe and that any public member that comes to our office remains safe as well. Now, the slide that you're seeing in front of you is our license, and most of the licensees that are on the committee will recognize this. And we've made some changes finally in the BREEZE system that allows the IV therapy specialty to show up on the ND's license. As you can see on the sample license, the NDF, or the Naturopathic Drug Furnishing Number, is to the right of the license number. And if appropriate, the IV specialty indicates that the licensee has met the requirements to have the IV therapy specialty added to the scope of their practice. Would you please advance to the next slide? On this slide, you will see a sample of what is viewed when a license verification is conducted through the BREEZE license lookup. In the red box, you will also notice the secondary status for the NDF number, and below that, if applicable, the specialty for IV therapy is indicated. This will assist pharmacists and others in knowing what scope each ND licensee has. Please advance the slide. Thank you. Okay, so this is part of my licensing report as well. This table shows the number of licensees practicing under the committee's jurisdiction. The NMC's total licensee count as of February 23rd, 2021 is as follows. The active current licensees are 907, inactive current is 22, and delinquent statuses are 143. This brings our total license jurisdiction to 1,072. Are there any questions about the licensing report before I move forward to enforcement? Any questions about staffing or COVID or anything else? Okay, I don't see any questions right now, but if anybody has anything, we can definitely come back to those. All right, can you please advance to the next slide? Thank you. Currently, the NMC has 71 total enforcement cases open. Of the 71 cases, 25 are against licensees, while the remaining 46 cases are against unlicensed individuals. The unlicensed activity still remains the largest portion of the NMC's enforcement caseload. This is, however, the lowest percentage of enforcement cases against unlicensed activities in the last 5 years. It does appear that the educational material that the committee sends out upon the initial complaint may be in part assisting to lower those numbers. We hope that continuing our educational and informational outreach campaign will keep the trend of lowering the unlicensed activity within our committee. Unlicensed activity consists of the following: using a naturopathic doctor title or the ND title, not providing a written disclaimer of unlicensed practice to their clients and having a signed copy of the client on file, providing diagnosis, and providing treatment within the scope of a naturopathic doctor. There were 6 cases received since our last meeting on 12/1, and no cases have been closed in that time period. Could you please advance to the next slide? Thank you. Types of violations. Currently, the NMC has 25 total enforcement cases opened on ND licensees. Of the 25 cases, the breakdown of violation types are as follows. There's 10 advertising violations, or 40% of the cases. Failure to update address with the committee, 2 or 8%. DUI-related violations, 3 or 12%. 2 of these are based on applicants who are provided prior conviction information during the application process. Unprofessional practice, 7 or 28%. Records, 1 or 4%. And death or patient harm is 2 or 8%. And although this includes death and patient harm, please know that they're only patient harms. There are no deaths currently. Are there any questions for the enforcement report? I don't see any.
I just had a quick question, Rebecca. Was that a failure to release records?
Yes.
Is that what that means?
That is, yes.
This is Dr. D'Amico. So unprofessional practice may be in regard to not keeping adequate records, correct?
It could be, yes, that is correct.
And this is Dr. Singleton. I'm just curious if any of these enforcement actions have been delayed or resolution of them because of low staffing?
Yes. So currently I've been working on the most egregious cases. Of course, any of the patient harm, unprofessional practice, that type of thing. The advertising and failure to update address, although they are violations, it is at the bottom of my pile. So yes, some of these have been kind of pended a little bit just because of my time and ability to work on the cases, which is why we really need to get a temp help in here that can assist. It is unfortunate that I'm trying to get a retired annuitant in, which are basically staff that have retired out of the state and want to come back and work with the state again in a retired capacity. I am trying to find somebody with some enforcement background so that it is easier to train them, because training for enforcement takes quite a long time. And so if somebody had that knowledge or even a little bit of that knowledge, it would be very helpful. I did find one that had some enforcement background with the Department of Consumer Affairs. However, the last time that they logged on to the program that we use in order to find these people, their last logon date was in 2013. So probably not going to be a very good candidate. I am going to attempt searching some more and putting a job duty advertisement up to try to bring in some I don't know, initial responses in finding a candidate. But if we can't, then I will probably have to go out and bring in a limited term person. And at that point, we're paying for benefits and all that kind of stuff. And I was really trying to save as much money as possible. Unfortunately, like Carl was providing you the information about our budget, once a budget is created, you really don't have much wiggle room. We are down to the penny every single time at the end of the year of our budget. I think this time we're projected to have 0.58% reversion, which is very, very little. So we don't have a whole lot to work with. We did have some cost savings for some salary savings. So we have about $50,000. So I'm trying to bring in somebody that we can pay using that $50,000 without going over and blowing our budget. So that's kind of where we are at right now. Are there any other questions? Okay, I don't see any. So we're going to go ahead and go to the strategic plan update. Thank you. The committee developed and adopted a new strategic plan on January 28th, 2020 for the period of 2020 through 2024. Within the new strategic plan, the goal areas were important to the committee during this planning period were licensing, enforcement, legislation and regulations, administration, and outreach and education. Under licensing, the three important items to the committee were 1.1 to clarify and communicate the turnaround time for the license applications and renewals to manage expectations. 1.2 to empower applicants to monitor their own license application process to improve customer service. And 1.3, update website information regarding committee-approved continuing education offerings to provide current licensee information to licensees. Sorry. Can you please advance? Thank you. And I know this is kind of small, so I apologize, but this is part of our action plan that the staff and I, along with the solid team, put together in order to kind of stay on track to make sure that each one of those goals that the committee came up with were met by the end of our strategic plan period. 1.1, the clarify and communicate the turnaround time for license applications and renewals to manage expectations. We're supposed to have started in Q1 of 2020, and Q2 of 2020 was supposed to be the end date. Unfortunately, due to COVID, it really did throw a lot of our planning off for a lot of our goal areas. However, what we did was we just kind of took those and we kind of rescheduled it. So I'm going to go through some of those now. But these here were pushed out to the first and second quarter of 2021, and we are currently working on ensuring that the staff is processing all applications within performance measure timelines, run reports to track license work processed by staff, and add time frame for processing applications, initial and renewal to the website. We are looking to do that, and hopefully we can have something on the website as soon as we bring on our new web page that will show what our current processing times are. 1.2, to empower applicants to monitor their own licensing application process. This was supposed to be done between Q1 and Q2 of 2020. I am happy to say that the majority of this has been completed. We created a letter for online registration directions. So when we get an application come in, we send them information on how to track their process through the BREEZE system. We also send letters out for online registration upon, oh, I'm sorry, I already said that. We added the online message regarding BREEZE services to the website. We've updated the required documentation for applications in the BREEZE system, and that on the day that those documents arrive in our office, we are putting them into the system so that the applicants can track their deficiencies and processes in real time. These items will have all been completed by Q3 of 2020. We're still waiting for some of those documents, automated documents, to be completed by the correspondence team on BREEZE.
I think you mean 2021, right?
I'm sorry, 2021. Yes, that's right. Update website information regarding committee approved continuing education offering to provide current information to licensees. Was supposed to start in Q2 of 2020 and end in Q2 of 2020. This was the success measure for this was to consistently post approved CE courses. The major tasks were to update current CE list format. That has been completed, and we do keep track of that in office. Add CE courses approved by the committee on website under the CE tab on a monthly basis. This will be in tandem with the new website around the Q2 of 2021. Add CE courses approved by CNDA on the website under CE tab on a monthly basis. We are currently keeping track of all of the CNDA approved courses, and this will also be done in tandem with the new website around the Q2 of 2021. Does questions on those before I go to the next slide? Okay, seeing none, I will go ahead and ask to go to the next slide, please. All right, the second goal area in the strategic plan is enforcement. Under the enforcement goal items, the 3 items that were very important to the committee during this period were 2.1, strengthen penalties for illegal use of ND title to protect consumers from unscrupulous practitioners. 2.2, to improve the efficiency and enforcement reporting and internal notifications through the BREEZE system to aid enforcement timelines. 2.3, encourage licensees and stakeholders to report unlicensed activities to reduce unlicensed use of the ND title. And I'm sorry, there were 4 parts on this one. And 2.4, educate licensees in verifying and confirming that any professional practitioners they work with is appropriately licensed to prevent being in violation and further protect consumers. Please advance to the next slide. Thank you. In the action plan for goal area 2, we're going to start 2.1, strengthening penalties for illegal use of ND title to protect consumers from unscrupulous practitioners. Start date of that was Q1 2020, and the end date Q1 2020. Again, these were affected by COVID and lack of staffing in the enforcement. Dates have kind of been pushed out for some of these, but anything that has come in that we've had to go after an unlicensed practitioner, we have the ability to make the fine greater than what we were that we were originally issuing. However, we have not had to issue any citations within this last year. So that I think is a good thing. But just so that you know, that has already been put into effect. The success measure for this goal area is to decrease unlicensed violations. And we have seen some decreases in the licensing complaints. So I think that we are starting to kind of see a shift in the unlicensed activity. And I'm really hoping that this stays consistent from here on out. The major tasks were to increase fine amounts for unlicensed practice violations, especially for the repeat offenders. This was completed in June of 2020, that we have a new list of what those citations will be. Fortunate for us, we haven't had to use those yet. Add list of violators to a newsletter if still allowable, and to contact the AG liaison and DCA legal to determine if unlicensed violators can be added to the list on the website for consumers' right to know. I'm not sure if we can do this. I know that we had a situation several years ago before I came. We used to put out a newsletter, and there were unlicensed individuals that received citations from us that was put on that newsletter. And we had received a complaint about that, saying that we took their due process away from them by putting it out there like that. So we stopped doing that at that time. I don't know if it's something that would be allowed. However, I do feel that there should be a right to know once somebody is cited for a violation. I just don't know what the legality would be behind that. So I will definitely work with the AG's liaison and our legal staff to find out if this is something that we can bring back into play. 2.2, to improve the efficiencies and enforcement reporting notification through the BRIES system to aid enforcement timelines. This was also supposed to start in Q2 of 2020 and end in Q2 of 2020. The success measure for this would be to be able to stay within performance targets. The major tasks: to determine what tracking needs the staff has in processing enforcement cases adequately and to stay within performance measures. Work with and provide additional training for staff on enforcement case processing for intake, case management, and disciplines. Add and use additional cues within BRIES to assist staff in keeping within the the performance measure timelines. All of these tasks have been put in place and will be followed when additional enforcement staff can be hired. Okay, please go ahead and advance the slide. And thank you. 2.3, encourage licensees and stakeholders to report unlicensed activities to reduce unlicensed use of the ND title. This was supposed to start in Q3 of 2020 and end in Q3 of 2020. The success measure for this goal is to heighten public protection and increase the reports of violations. Major tasks: to add information to the website on unlicensed practice, what is and what is not allowed. Add information on website regarding how and why unlicensed activities should be reported. And these tasks will be completed in tandem with the new rollout of the new website in Q2 of 2021. 2.4, to educate licensees in verifying and confirming that any professional practitioner that they work with is licensed to protect licensees from being in violation and further protect the consumers. The start date on this was Q4 of 2020 and the end date Q4 2020. Due to COVID and staffing issues, this was pushed out as well. However, this will be done through social media plan and upon the rollout of the new website, hopefully by the end of Q2 2021. The success measure is that licensees have been reminded to verify professional licensure. Major tasks, add information on the website, reminding licensees to always check the license status of any professionals that they work with, whether it is an ND, an MD, a nurse, anybody. Of course, right now we can't work with nurses, but you get the idea. The next major task is to revamp the important information sheet sent out to all new licensees and renewal licensees. Please go ahead and go to the next slide. Thank you. Were there any questions on the enforcement goals before I go to the next? Okay, seeing none, I'll go ahead and continue. The third goal area in the strategic plan is the legislation and regulations. Under legislation and regulations, there are 8 items, I think, 8 items that the committee had that was important during this period. 3.1, to advance a plan to gain title protection to protect the public and aid in enforcement activities. 3.2, to modernize scope to allow licensees to practice as trained, improving primary care services and access for the consumer while creating parity with neighboring states. 3.3, advance scope of practice to meet legislative mandates of the committee. 3.4, open communications between the Naturopathic Medicine Committee, appropriate boards and associations in order to facilitate greater understanding of potential legislative and regulatory changes. 3.5, add North American Naturopathic Continuing Education Accreditation Council, or NANCIAC, as a continuing education provider to broaden continuing education opportunities. 3.6, to clarify guidelines for naturopathic medical assistance and create regulations as needed. And 3.7, to create intravenous and injection therapy regulations and guidelines to provide clarity and facilitate safe practice. And 3.8, to review and update naturopathic childbirth attendance statutes and regulations. Please go to the next slide. Thank you. 3.1, to advance the plan to gain title protection to protect the public and aid in enforcement activities. Start date was Q2 2020, the end date Q3 2020. This was pushed out to Q3 of 2021. The success measure for this goal area is the able to receive title protection in statute, of course. The major task would be to go through all open and closed enforcement cases in BREEZE 2016 to current and add missing unlicensed practice codes for tracking purposes. Run unlicensed practice reports, determine percentage of unlicensed activity versus licensee enforcement numbers, provide unlicensed activity findings to legislature, and request title protection during the 2021 Oversight Sunset Review. Of course, this was pushed out to next year. And go through all open and closed enforcement cases in BREEZE 2012 through 2015 and add missing unlicensed practice codes for tracking purposes. 3.2, to modernize scope of practice as trained to improve primary care services. Start date was Q2 2020 and end date Q2 2021. We have started this during 2020, but will need to extend through Q4 of 2021. The success measure for this goal area is to have a scope that allows the practice, to allow NDs to practice as trained. The major tasks is to research scope of all ND regulating states, strategize efforts and scope modernization to create parity with the neighboring states for national standards, create subcommittees to complete recommendations on the MOPs and drug formularies as original legislative mandates suggest, and the MOPs are the minor office procedures. Work with CNDA, lobbyists, legislators, and DCA legislative unit to modernize scope and allow to practice as trained. Please advance to the next slide. Thank you. 3.3, the advanced scope of practice to meet legislative mandates to fulfill mandate of committee. The start date on this was Q3 2020 and the end date Q2 2021. As with goal area 3.2, we have started this during 2020, but will need to extend through Q4 of 2021. The success measure for this goal area is to receive scope of parity with other ND regulators. The major tasks for this goal area is to create subcommittees to complete recommendations on the MOPs and the drug formularies as original legislative mandates suggest. Work with CNDA, lobbyists, legislators, and DCA legislative unit to modernize scope and allow the practices trained. 3.4, the open communications between the Naturopathic Medicine Committee, appropriate boards, and associations in order to facilitate greater understanding of potential legislative and regulatory changes. The start date for this was Q1 2020. The end date was Q4 2020, but due to COVID, this was pushed out to Q3 2021. The success measure is the authority to supervise RNs and LVNs. The major tasks for this goal area are to contact the BRN and LVN boards and associations for ND supervisory authority, work with CNDA, lobbyists, MBC, and CMA to modernize scope and allow the practice as trained, participate in workforces with other healing arts programs, and request the statute changes be made to NMC, BRN, and LVN laws. 3.4, open communications between the Naturopathic Medicine Committee, appropriate boards, and associations in order to facilitate greater understanding of potential legislative and regulatory changes. The start date for this was Q1 2020. The end date was Q4 2020, but due to COVID, this was pushed out to the end of Q3 2021. Success measure for this goal area was the authority to supervise the RN and LVNs. The major tasks, of course, some of that I've already stated, but with these is to contact the BRN and LVN boards and associations for ND supervisory authority, work with CNDA, the lobbyists, MBC, and CMA to modernize the scope, participate in workforces with other healing arts programs, and to request statute changes be made to the NMC, BRN, and LVN laws. Please go to the next slide. Thank you. 3.5, add continuing education provider NANCIAC to broaden continuing education opportunities. The start date was Q4 2020. The end date was Q1 2021. The success measure to have NANCIAC added as an approver in the statute. Major tasks is to work with NMC to approve NANCIAC as a CE provider, and this was approved by the committee during 2020. Ask legislature to add NANCIAC as an approver in statute during the 2021 oversight review sunset. As you know, our sunset was postponed, so this will be requested during the oversight review in 2022. 3.6, to create regulations and guidelines for the naturopathic medical assistants to provide clarity and facilitate safe practice. The start date for this was Q4 2020 and the end date Q1 2021. Due to COVID, this goal area has been pushed out to the end of Q1 2022. The success measures for this is a scope of NA clarified, and the major tasks for this goal area is to research the NA laws in surrounding states, work with NMC to determine if any regulatory changes need to be made to assist in clarifying the NA scope or whether an NA FAQ will be sufficient. And I think maybe the FAQ will probably be sufficient, but we do want to look and see what other states are doing for their naturopathic assistants. Do I have any questions on any of these before I move forward? Great, we'll move right along then. Please go to the next slide. Thank you. The 3.7, create intravenous and injection therapy regulations and guidelines to provide clarity and facilitate safe practice. Start date for this was Q1 2020, end date Q1 2021. This goal area has been completed and a regulatory package is currently in process. Success measure for this goal area is to have regulations passed. The major tasks were research the IV and injection laws in other naturopathic doctor jurisdictions, create regulation language and assist in clarifying scope, and process regulatory package for the therapies. 3.8, to review and update statute and regulations for naturopathic childbirth attendance to enact current statute and enable licensing. The start date for this was Q4 2021. The end date is Q4 2022, and it still looks like this school area will start in Q4 2021. The success measure for this goal area is the barrier removed for childbirth attendance. The major tasks are to work with the committee to create new certification process and remove current barriers, to research childbirth attendance laws in other jurisdictions, and to reach out to the exam administrators and Council of Midwife Education to get ND's schools approved and added to their courses. Any questions on those? Okay, seeing none, I'll go ahead and go to the next goal area. Please advance. Thank you. The fourth goal area in the strategic plan is administration. Under administration, there are 2 items important to the committee during this period. The first one, 4.1, was to create more email templates and voicemail branches to increase efficiencies in public service. 4.2, to identify and implement a resource to assist members in tracking the committee's work. Please go to the next slide. Thank you. 4.1, to create more email templates and voicemail branches to increase efficiencies in public service. The start date on this was Q2 2020. The end date Q3 2020. The success measure for this is more information outlets have been added. Major tasks, staff to create new templates to automate response during processing applications and enforcement cases online. This has been completed. Staff work with Breeze BIA to add templates to correspondence unit. This is currently being done, and the Breeze should have these templates added during the next system release. Work with DCA Telecom unit to create phone branches to allow callers to access the FAQ information. New phone lines have been added, and we're currently working with DCA's Telecom to add the branches that will provide additional information to callers. 4.2, identify and implement a resource for tracking the committee's work to enable committee members to monitor the progress of the program's work. Start date for this was Q1 2020, and the end date Q2 2020 and ongoing. The success measure for this goal area is keeping committee apprised of their work. The major tasks, consult with OIS to determine if there's a way that we can get software that can track this without violating any Open Meetings Act. I was told at this time they don't have anything that can do this. And the next was to share action plan and Gantt chart with the committee members quarterly. And this is what we're doing at this time. If you guys prefer, I can send this to you offline as well, so that you have this going forward once every quarter. Are there any questions about that goal area? I see a question from Dr. D'Amico.
Yes, so on this point, it's great to go through this as we are to remind us of our strategic plan and where we are. I would love to see another column added to each of these little tables that has a check mark or maybe a dot or dash to indicate it has begun or is in process or has been completed for each of the individual items and for the success measure itself. Sometimes we may find that we can finish the success measure without necessarily doing all of the tasks because they are kind of strategic ways that were developed to try to accomplish it, but the success measure is what's really most important. And that way, in future meetings, we could briefly go through what's been accomplished, ask questions about any of the unaccomplished, and you wouldn't necessarily have to read every single line.
Yes, you are correct. And that is what we will be doing from here on out. I will be sharing the Gantt chart with you guys offline so that you always have that available to you. And the Gantt chart will actually show when we were supposed to get it done, and then kind of like you said, it'll show where we are, if we've started, if we are in process, and if we're within our timeline, and then of course once the goal has been met.
Great, thank you.
You're welcome. I just wanted to make sure that we did this one time so that everybody is kind of on the same page moving forward with what those plans were.
Yeah, we don't necessarily remember the details a year and a half later, so that's a good.
Right. Yeah. All right. And I think I seen a hand raised from Dr. Davidson. Do you still have a question?
Thanks. Yes. Well, I guess so are these posted on the website for us to look at? I don't remember these as being attached to the email that you sent out originally. So are these available for reference?
Yes, I will definitely send out the action plan to you guys so that you have that available at all times. And then the Gantt chart I will send out on a quarterly basis so that you guys are up to date on exactly where we are on those goal measures. The action plan is not on the website just because it's just an action plan that we use internally, but the strategic plan is definitely posted to the website, and I will make this action plan available to the members.
Great, thank you.
You're welcome. And I think I seen Dr. Thompson with her hand raised too, but it's down now. Did you have any questions?
I did not raise my hand.
Oh, okay, then I must have seen a different hand. Okay, perfect. If there's no other questions, I'll go ahead and continue because we're almost done. All right, next slide, please. Thank you. All right, the fifth and final goal in the strategic plan is the outreach and education. Under the outreach and education, there are 7 items important to the committee during this period, and those are 5.1, to explore the opportunities to educate legislators, health-related boards and professionals, associations about naturopathic medicine and naturopathic medicine committee in order to inform and foster relationships and support. 5.2, to develop outreach campaigns to educate the public about naturopathic medicine. 5.3, communicate the approach of naturopathic medicine to vaccines, homeopathy, and supplementation to clarify misconceptions. 5.4, communicate the process of appealing consumers' insurance denials to ensure parity between healthcare professional services and improve patient access. 5.5, increase frequency of online communications and website updates to better educate the public and licensees. 5.6, coordinate with the California Naturopathic Doctors Association to facilitate communication with licensees and public. And 5.7, to create Health Insurance Portability and Accountability Act and telehealth links to clarify laws for licensees. Please go to the next slide. Oh, there you are. Sorry. Okay, so 5.1, exploring opportunities to educate the legislators and educate health-related boards and professional associations. The start date for this was Q2 2020. The end date was Q3 2020. Due to COVID, this was pushed out some. The success measure for this goal area is that the legislators know who we are. The major tasks is to reach out to the CNDA lobbyists and DCA legislative unit to determine appropriate legislators to contact for education and outreach. This is currently in process. Reach out and work with MBC and CMA. Currently in process. Prior to the COVID, the committee did do a presentation on the education and training of NDs to the Medical Board of California, and it was received fairly well by their board members. And the last is to create a newsletter quarterly or semi-annually and provide committee updates, work with DCA Public Affairs Office. We're currently working with the Public Affairs Office to develop the social media accounts that will allow us to engage with licensees, stakeholders, and consumers. All right, and 5.2, develop outreach campaigns to educate the public about naturopathic medicine. The start date for this was Q1 2020, the end date Q2 2020. The success measure outreach campaign developed and implemented. The major tasks were to collaborate with DCA PAO to develop an educational outreach campaign to NMC. This has been completed and are awaiting the rollout of all of the social media accounts. And add the brochure purchasing information to the website, and this will be added in tandem with the rollout of the new website. Thank you. For 5.3, to communicate the approach of naturopathic medicine to vaccines, homeopathy, and supplementations to clarify misconceptions. The start date for this goal was Q2 2020, the end date Q3 2020. This is actually starting in Q2 of 2021. The success measure to have a white paper with misconceptions clarified. Major tasks works with committee members to provide statements on misconceptions related to ND vaccines, homeopathy, etc. 5.4, to communicate the process of appealing consumer insurance denials to ensure parity between healthcare professional services and improve patient access. Start date on this was Q1 2021, end date Q2 2021. Success measure for this goal is to have insurance carriers no longer denying naturopathic doctor treatments. Major tasks: create online information page on how to appeal insurance denials for ND treatments. We're currently working on this to have it ready for the rollout of the new website this year. 5.5, increase frequency of online communications and website updates to better educate the public and licensees. The start date for this, Q2 2020, the end date Q2 2020. Due to COVID, this was pushed out, but currently being worked on, should be released by the end of Q2 2021. The success measure for this goal area is the website transition to the new look. The major tasks: connect with DCA web team for scheduling. Of course, we've already done this. We're just now waiting to get all of the information gathered and given to them so that they can go ahead and get the new website put together. 5.6, coordinate with the California Naturopathic Doctors Association to facilitate communication with licensees and the public. Start date Q2 2020, the end date Q2 2020. This has been completed. The FAQs will be added to the new website. The CNDA also has on their website some frequently asked questions that they were able to work with us on, and we were able to give those to them. So the success measure for this goal area was less calls and emails on those FAQs. The major tasks was to combine all the FAQ lists from CNDA and NMC and make sure that they're on our website for us to post.
This is Dr. D'Amico. Rebecca, are you noticing less calls because of those yet?
I am actually. We do get a lot less calls on some of those really frequently asked questions. So that's good. And I think CNDA is doing a really good job in making sure that their members have this information as well. So I think that it is definitely helping.
Excellent.
And the last but not least, 5.7, to create HIPAA and telehealth medical board of California links to clarify law for licensees. Start date Q2 2020, end date Q2 2020. This has been completed, and the information online is the most current telehealth information for the use during COVID, because as everybody knows, during COVID, the telehealth and the HIPAA has been kind of loosened a little bit. So there are definitely guidelines on our website right now that will assist the licensees in knowing how to kind of maneuver that. In addition to that, we have some information on general telehealth toolkit, the HIPAA guidelines on telehealth, Medicare telehealth care provider fact sheet, Medicare telehealth FAQs, and of course the DEA clarifications on Schedule 2 through 5 controlled substances. This information was gathered from the AANP, and as soon as our new website is up, those links will be on there for our licensees to use. Any questions on that? Okay, great. I don't see any. All right, I am done with that section. Do we have any public comments?
At the direction of the committee, I have opened the Q&A panel. If you would like to make a public comment, please type "I would like to make a public comment" and send to all panelists. I will pause a moment to allow individuals time to access this feature. At this time, we have received no requests for public comment. Would you like me to close this feature?
Yes, please. And I just want to say to Rebecca, that's really an impressive body of work that you just presented. So thank you so much for your ongoing efforts.
It's my pleasure.
I think you have one more item in your executive officer update.
Yes, I kind of did. It was the AB5, the independent contractor stuff. The only reason I didn't bring it up is because I think we've kind of put this to bed, but I will kind of give a brief information to the rest of the committee. Let the AB5, because it deals with the independent contractors and the basis of the practice, the makeup of the practice and taxes. We were told that this is something that we probably should not get into, and this is something that's more suitable for the CNDA to go after if it was concerning or challenging to the naturopathic doctors. So the CNDA does know about this, and if needed, they will pursue getting on any other bill that fixes some of the independent contractor issues. Dr.
Thank you. So thank you so much for all of that, Rebecca. It looks like the next agenda item is the establishment of a sunset review subcommittee. I just want to make sure that I clarify, this subcommittee would be working in order. Now, our sunset review has been pushed to what exact date?
So we will start working on it in 2022 for the law to be effective January 1st, 2023. But before we move forward, I think Dr. D'Amico had her hand up on the AB5 stuff. So let me ask her really quick if she still had a question.
Thank you. Legislatively, can you address where we are on cannabis subject?
I will, because it's not on our agenda, we can't speak on it, but I will definitely send you offline about the use of actual THC versus hemp-derived CBD.
Okay, if we would, I would love it. Is that, can I ask if that is still a pending issue or if that's closed for the committee?
It is closed for the committee, and I will definitely send you offline where we are with that. I'm sorry, that should have already been established, but if you didn't get that, I apologize.
I'm sorry if I didn't. If I got it and I don't remember it, I'm sorry about that.
No worries at all.
Are you able to speak to the status of appointments for our committee?
I can let you know that it's definitely not on our agenda, but we have been in communications with the governor's office, appointments office, and it is in the works. We're just trying to find candidates that are willing to apply. Okay.
And my last question is, I think there's always some new required trainings for our committee members every year. And I was just wondering if there's any that we need to be aware of that'll be coming up soon.
Yes, you guys should have received a couple of emails from the Department of Consumer Affairs in regard to some of those trainings. I will go ahead and follow up, sending an email out this afternoon with any trainings that you guys need to take care of this year.
Thank you.
Okay, no problem.
Thank you so much. So the establishment of the sunset review, now is this a subcommittee that we're establishing, Rebecca?
Yes, it is.
Mm-hmm. So this would be 2 to 3 members, correct?
2 members.
2 members.
Mm-hmm.
And would the purpose of this subcommittee be to sort of oversee the preparation for the sunset review and make sure everything's, in the timeline, et cetera?
Yeah, and I think for the most part, using the data that's collected by the staff, the committee would be able to work on some of those report sections. And with only having 2 members, they'd be able to work on the report without having to meet the Open Meetings Act and to work on an ad hoc basis, just kind of when needed. So if anybody was interested, I know that Dr. Davidson is really good when it comes to data. So if anybody wants to definitely put their hand up on this one, I would greatly appreciate the help. The sunset or oversight review report is quite large. It's in lots and lots of sections. Most programs have different staff and different managers that would take a section each, like the enforcement and the licensing and administration and all that. Unfortunately, we don't have that. We have me. So if we can get some help on that, that would be great, because the last two that I had to do were quite extensive and takes a lot of time. Dr. D'Amico, you have a question?
I would be willing to serve on this committee or nominate Dr. Yoon to do so. I think either one of us would be a good second person.
Great. Dr. Yoon?
Hi. Yeah, that's perfectly fine.
All right. Would you guys like to work on it together then? Dr. Davidson, I see you have your hand raised.
I would be willing to participate.
Okay. I mean, maybe we can have a couple of subcommittees for this, like one takes the licensing, one takes enforcement, or I don't know. I need to see the report before I know how it can be broke down a little bit, but maybe we can just have two subcommittees of 2 people each, and that would really help me out.
I like the idea of having 2 separate subcommittees of 2 people so that we don't have to post the meetings, but having the extra help of not just having 2 people supporting. We certainly could have one person. Can we have one person who's on 2 different subcommittees for this, or do they need to be completely separate?
You know what? Let me check with Sabina on that, because it's the same thing. I don't know if that would be considered a violation or not. Sabina, do you have any?
Right. So, excuse my ignorance or possibly not understanding. How would you like to possibly divvy up the work?
So what we're saying is that we want the subcommittees to be 2 people so that they do not have to deal with the Open Meetings Act. However, it would be nice to have 2 separate subcommittees that are working on separate sections of the sunset review, so as to just have more people helping.
Got it. Okay. Also, Rebecca, wouldn't it be prudent for the president to be on these subcommittees, since the president would most likely be testifying with you?
That would be correct.
I assume you mean the chair, which is me, right?
That's correct.
Oh, yes. Sorry.
Yeah, that's fine. So what we could do is we could have a subcommittee with myself and Dr. Davidson, and then a subcommittee with Dr. Yoon and Dr. D'Amico. Does that work for everyone?
Yes.
That would certainly work with me. And again, I'll have information as I get that template that comes from the legislature. Right now, I don't know exactly what they're going to be asking this year, but I can only guess that it's similar to what we've received in the prior years. So it's really is broke up into licensing issues, enforcement issues, and all of the data of those performance measures. Any legislative issues that we run into, and of course we all know we have tons of those. So there's a lot to the report, the background of naturopathic medicine, the background of the committee, and I can definitely provide all of that information, just because that information never changes. We're always going to be the committee, and our history is pretty much always going to be our history. So that stuff kind of stays the same, but there's a lot of new information that we have, a lot of new data. And so with that, those are the pieces that we're really going to have to be kind of taking a look at. So when I do receive that template, I will share it with the chair, and we can figure out like who can take what. Again, I know Dr. Davidson said in the past that he's a data guy, and that's great, because I know there's certain minds that that love data, and I'm not one of those. So although I have to work with it all the time, I'm not one that loves it. So there's that, but we can definitely move forward with just getting the subcommittee ready now, and then divvying up what they do when we get that information from the legislature.
This is Dr. D'Amico. I might suggest that we consider when we get to that point, rather than dividing up the whole thing. I was the subcommittee for the last sunset review, so I'm familiar with the lengthiness of the document. But it might be worth doing a first pass through Dr. Davidson and Dr. Thompson for data accuracy and the overall flow. And then it could come to the second subcommittee to work out all of the details, and then go back by Dr. Thompson for one last look, as well as Rebecca. But just my suggestion that we all work on all of it, because we're all going to see different things. And Bruce can kind of really focus on data accuracy before we go in and make conclusions about that or correct the language or whatever.
This is Sabina. So just as a reminder, your committee would need to be 2 people. And as board members, you will be seeing the sunset report regardless of whether you're on the subcommittee or not. So there will be opportunity for you guys to review it regardless if you are on the subcommittee or not.
Good.
Correct. So Dr. Thompson, if you don't mind, maybe we could just go ahead and establish the 2 subcommittees now, and then we'll work through just kind of the particulars as soon as we have more information.
Yes, so at this point, we will establish the 2 separate subcommittees to work on the sunset review. The sort of delegation of work and activities is to be decided, but we're establishing 2 separate subcommittees. One would be myself and Dr. Davidson, and the other will be Dr. Yoon and Dr. D'Amico. And is this something we will revisit on our next meeting as well?
Absolutely, we can definitely do that. Hopefully by then I'll have the template of what the report is going to be requiring.
Excellent, thank you.
Okay, you're welcome. All right, I think at this point we can open it up for public comment, please.
This is the moderator, and at the direction of the committee, I have opened the Q&A panel. If you would like to make a public comment, please submit. I would like to make a public comment. I will pause just a moment to allow individuals time to access this feature. We have received no requests for public comment. Would you like me to close this feature?
Yes, thank you.
Feature has been closed.
So at this point, we're moving on to our next agenda item, which is future agenda items, many of which we've discussed during the meeting, and our next meeting dates. Are there any other agenda items that people want to make sure go on our next or future meeting dates that we have not already? I don't see any raised hands at this point. Rebecca, did you have a comment on that?
No, I was just opening up my mic just in case anybody wanted to put anything on there. So we have the subcommittee for the social media. We've also have the subcommittees for the sunset review and all of the other items that we went through in the meeting. It looks like Dr. D'Amico might have one. Dr. D'Amico?
I think we always have a budget check-in on our agenda, but I'll just say, as the ability that I've been able to gather, to the extent I've been able to gather information, it seems like we're lowering the amount of income we have both through licensees and because of budget rollbacks. And yet, anyway, I think just checking in about that, and at some point we want our executive to have salary parity, which is probably not possible this year, but I imagine that's on the next agenda, right? All that stuff.
I do appreciate that, Dr. D'Amico. That's probably a moot point right now with all of the budget restrictions that we have. But yes, the budget review will be on the next meeting, and I will ask Carl to give you guys a breakdown of kind of where we are with our fund condition. I know we're a little bit better off than what we anticipated with the projections. I think this year we only projected to bring in a little over 400,000, and with the projections that are currently looking at around 615,000. So we're definitely bringing in a lot more than what we anticipated. That may assist us in making that fund a little bit better so that we can ask for that BCP and get another full-time enforcement analyst in here. Just with the kind of, uptick in the licensees coming, and hopefully if we do start getting some parity with other states, it'll keep our licensees here. And at that point, we're going to need more staff. We just can't do it with 1.5 people. We can barely do it with 2 people. So we definitely want to bring on additional people. So I will have him give a full on budget report next time so that you guys have all those figures in front of you. And I will send it to you offline as well.
Thank you so much. As far as future meeting dates, are there any specific deadlines that we need to meet before those happen so that we have some parameters around that?
If you don't mind me getting the BCP started in April, then we don't have to scurry to have one in March or April. Would be nice to have one sometime, I would think maybe the end of April through the end of May would seem that it would be appropriate.
I would suggest that we do get our meeting date in early May if possible. There are a lot of vacations and breaks, and I know that that's adjusted because of current COVID situations, things that happen during the month of April, a lot of, for people who have kids, a lot of spring breaks and things like that. And then when we get to the end of May, that also bumps into several holidays and things. So if we did sort of late April to early to mid-May, I think that would be a time that would probably work well for most people's schedules.
Okay. Let me take a look at my calendar really quick. I'll go over to the end of April. So the end of April, except for the 21st, looks pretty open for me. And then May, the first 3 weeks in May are completely open for me.
Are there particular days that are better for people? We've done Tuesdays and Thursdays sort of predominantly over the past year and a half.
I think that sounds about right.
This is Sabina. I have some conflicts, but I'll wait to hear what everybody ends up deciding on.
This is Dr. D'Amico. I have an intuition about the first week in May.
I think that would be great. So maybe the 4th or the 6th?
Yes.
Does anyone have a conflict on the 4th?
Yes, I apologize, but I'm out of town May 3rd through the 10th. Sorry to complicate things.
No worries.
What about the previous week, the last week in April? What are the dates on the Tuesday and Thursday there?
So for April, the last week in April, we've got the 27th and the 29th.
Does anyone have a conflict on the 27th?
I do. Sorry, this is Sabina. I just had to scroll through my calendar. I have board meetings April 26th and 27th. May 6th and 7th, and May 13th.
What about the 29th of April, Sabina?
No, I'm good there.
Does anyone else have a conflict on April 29th? Sounds like April 29th at this point works for everyone, so I think we should get that scheduled.
Okay, so I have a Thursday, April 29th for our next meeting, and I'm sure we will be doing the same virtual type meeting that we are doing today because I hopefully will be open. I don't think it will be, so I will put that down and we'll send everybody a reminder.
Thank you so much. Do we need to ask for public comment on this particular item?
This is Sabina. You're okay.
Okay, great. All right. Are there any other items that we need to address today?
I think we're good unless anybody has any questions.
Okay, I'm not seeing any questions. So at this point, I would like to adjourn our meeting. So we are adjourning the meeting of the Naturopathic Medical Committee on February 25th, 2021. It is 1:12 p.m. Everyone stay safe, and I look forward to speaking to you in April.
Great. Thank you, everybody.
Thank you. Great meeting.
Thank you.
Thanks. Goodbye.
Thank you to our moderators as well. Thank you so much.
You are very welcome. This is the moderator, and at the conclusion of this meeting, I will be ending the meeting now. Thank you.